Today we will be discussing Impetigo. This is a presentation by Group 6.
What causes impetigo? Impetigo is a skin disease constantly instigated by bacteria. It typically presents in younger children and its infection is regularly rising from spots of slight skin disruption like abrasions or other forms of broken skin. Impetigo is frequently transmitted in locations where there's close interaction, for example, within families and schools. Lack of adequate individual cleanliness might also increase the spread of infection. What are the symptoms of impetigo? Impetigo is characterized by lesions or sores in exposed areas like face and limbs. Non-bullous impetigo is more common and occurs when the original lesion is superficially found on the skin and ruptures relatively easily, often releasing an exudate which results in a yellow-colored crust when it dries. Bullous impetigo is a superficial fragile bulla containing sebaceous fluid or porous forms and then ruptures to form a round, very erythematous erosion, often with a surrounding colorate of scale. What if we don't treat impetigo? It is believed that even without treatment of impetigo, spontaneous resolution can be expected within 2 to 3 weeks. As impetigo is a highly contagious skin infection, complications can arise if it's left untreated, particularly if it is bullous impetigo. This infection can spread by fingers, apparel, towels, or it can also spread to other areas of the same infected body and make it worse. Untreated impetigo can lead to kidney problems or even kidney failure. It can also lead to deadly diseases such as osteomyelitis, septic arthritis, pneumonia, or acute glomerulonephritis.
How do you treat impetigo? There are many treatments for impetigo, including antibiotics, systemic antibiotics, or disinfectants on the affected skin, all depending on severity. A patient may be prescribed a relatively inexpensive antibiotic topical formulation to administer on the affected area or oral antibiotics. It may also be recommended to use topical disinfectants. There are natural remedies used in many parts of the world as a treatment for impetigo. Many medical health professionals recommend supplements to aid in management of acute infections. What is the recommended treatment? It is recommended that the treatment be administered based on pediatric analysis of severity. If the case is mild, an antibiotic topical formulation may be prescribed, whereas if the case is severe, immediate administration of systemic antibiotics is recommended. The most common and effective course of treatment for mild to moderate impetigo is topically administered antibiotics. Who will treat the impetigo? It is prudent to first make an appointment with the patient's primary care physician, in this case a pediatrician. If a diagnosis is uncertain or symptoms worsen after treatment, the pediatrician may refer the patient to a pediatric dermatologist or an atopic dermatitis therapist for further medical guidance. The doctor will then diagnose and prescribe an effective course of treatment. Thank you for listening to our presentation.